this morning. And so it's my prayer that the grace and the power of your Holy Spirit would be with her to anoint her lips and her mind so that she can speak and present clearly. And we pray for all the technology that's involved in this presentation so that it would work correctly. And then we also pray for ourselves that we would not only have ears to hear and understand, but a heart that would be motivated to change so that we can live more healthfully to advance your kingdom and cause. We pray in Jesus' name. Amen.
Amen. Amen. Thank you, Pastor. All right. Good morning, everyone.
Good morning.
So good to see you all here. I enjoy speaking about this topic. Fighting arthritis with food. Fighting anything with food is one of my favorite topics to go over because God is so wonderful and merciful. He's given us food as medicine. And so we'll see how we can use that with our arthritic conditions. So I am a rheumatologist, as Pastor said, and I've found that over the years, many people are not really used to the idea that food can fight arthritis. We've adopted the idea, or we've accepted the science that says that food can fight diabetes, food can help to lower your cholesterol, but food and arthritis, that hasn't really become mainstream information. But I can tell you that as a rheumatologist, someone who sees autoimmune conditions and lots of inflammation, that what we eat every day can either make arthritis better or make it worse. And especially as an arthritis patient myself, I know that food makes a difference. Arthritis is in my family from generations and generations. It's like we all seem to get it. But when you change how you live, you can change how you feel. So I give God thanks for that. Arthritis affects millions of people. And I want us to really understand how it works.
Check your on-off switch and make sure there's...
Oh, yes. Awesome. That always helps.
If not, you can advance it with your arrow key.
All right. Okay. No problem. I use my arrow key. Let's see. I know this should work. I'm just not pressing something here. Do you know where to point to, or? Okay, all right. So it's that one. Okay. Oh, it needs time. Okay. Okay. All right. Thank you. All right. So understanding arthritis. Okay. So I want us to really understand what arthritis is. So arthros is the root word for arthritis, and arthros means joint. A joint is where two bones come together and articulate. And then itis means inflammation. So arthritis is inflammation of the joints. Wherever two bones meet and you have inflammation, you can have pain, swelling, and tenderness. Now, there are many different types of arthritis. Let me ask you in this room, how many types of arthritis do you think exist out there? I always get different numbers. 3 types of arthritis. Okay, how many? Anybody else? As many as? Okay, so give me a number. How many types of arthritis you think there are? 206. Okay, so I have 206. There are almost 130 types of arthritis. So you're both very bold to give an answer. Thank you. There are many types of arthritis, and that we make the diagnosis based on what's causing it and where in the body it's found and how it presents. So in rheumatology, we spend our time listening to you, examining you, doing blood work, x-rays, then trying to put it all together to give you the right diagnosis of what you have. The 2 most common kinds of arthritis are osteoarthritis and rheumatoid arthritis. We've all heard of those. Osteoarthritis is really referring to the arthritis where the bones are wearing out. The cartilage between the bones is kind of getting thin, and now the bones are touching and rubbing and hurting. That arthritis you get when you're active. You're walking and it hurts when you move. You find that it can get worse over time. It starts usually in the 40s or 50s, and it mostly affects weight-bearing joints, joints that carry load. So your knees, your hips, your lower back, your neck that has to carry your head. Those are the most common areas. Rheumatoid is different. Rheumatoid is not so much a mechanical arthritis, but it's more autoimmune, where your body recognizes your joint lining as a foreigner and starts to attack your joint lining. This arthritis tends to affect women more often than men, and it starts much younger, in the 20s and 30s. In this type of arthritis, it's more symmetrical. Both hands, or let's say both wrists, both elbows, and it affects smaller joints, not so much bigger joints. So they look different. Now, how do we treat arthritis? Well, the best treatment is really to start with lifestyle changes. What you eat, how you move, how you sleep, how you stress. But when you go to your doctor, that's not usually the first thing they'll tell you. The first thing is usually, okay, let's try some medications. The medications that are more often used are things like NSAIDs, non-steroidal anti-inflammatory drugs. Now, those can be helpful sometimes, but they never address the root cause. And they have a nice long list of potential side effects that we need to be aware of. These side effects include things like stomach ulcers, which I've seen all too often, bleeding ulcers, decreased function of the kidneys, elevated blood pressure, ankle swelling, and many more. So whilst they can help to decrease pain and inflammation, we need to be very mindful of the potential side effects. And NSAIDs are medications like Aleve, your ibuprofens, your naproxen, that category of drugs. There's also the medications that are called steroids. Now, steroids are like wonder drugs. And when I give this sometimes, I become a patient's best friend because all of a sudden, all the pain goes away. They have all this energy and they're healed, right? But shortly after, I become their worst enemy because they cannot get off this drug. They're gaining weight, they're grumpy, they're eating everything in sight, and they're like, get me off this drug, doc. And it's so hard to wean a patient off steroids sometimes. So yes, we have medications, but we're not hitting the root cause, and the side effects are there. Physical therapy, a very important modality when it comes to treating arthritis. In physical therapy, they are strengthening your muscles to help keep your joint more aligned and decrease instability. So I love sending patients to physical therapy. But I tell everybody, PT is just for a short time. You're only with them for a few weeks, maybe a few months. So whatever you learn in PT, you got to do it at home. You got to keep doing the exercises at home. It's not going to just be that short span with physical therapy. And of course, surgery can be useful in severe cases. All right, so let's go the other direction. All right. So what is the connection with food and arthritis? Well, it's important for us to realize the fundamental fact that food can cause inflammation or food can improve or eliminate inflammation. That's the connection there. Because arthritis is what? Arthritis is inflammation where? Yes, where the joints are, where two bones come and articulate. That's inflammation. So food comes in by modulating the amount of inflammation. Okay, so what is inflammation? We keep throwing this term out as if it's regular, vernacular. What is that? The Latin term inflammatio is where you get that word from, and it means to set on fire. That's what inflammation comes from. It's a natural response by the body to fight. There's some kind of toxin, some kind of trauma, some damage, something is going wrong, and the body is prepared to fight back with inflammation. Now, here's a schematic for you to kind of see. This is a layer of skin, and something has broken the skin barrier. Some kind of toxin, bacteria, bug, virus, something. There are white cells hanging around right there to identify foreigners. The white cell picks up a foreigner and quickly sends messages down to the bloodstream. It sends tweets, emails, texts, messages. Somehow there is something going on here and we need help. The message goes to the blood supply, and then other white cells are recruited and they send up a lot of ammunition, cytokines, chemokines, different kinds of responses to annihilate this invader. With this war going on, you get swelling because of more blood flow, you get warmth because of the increased dilation of vessels, and you get pain. That is inflammation right there. Now, inflammation is not a bad thing. It's actually necessary. When it's short term, it's good. A few hours, maybe a few days, it will help to repair the damage, to get rid of the toxin, and your body will heal over time. Examples are things like if you get a cut, a sprain, a little virus, you have acute inflammation. The problem comes in when the inflammation is continuous. It does not stop. That is called chronic inflammation. That lasts months to years. Imagine years of inflammation. The tissues and organs, they get damaged. And symptoms can be as subtle as fatigue. Why am I always tired? You could be very inflamed. Also, pain, low-grade fever. These are just subtle symptoms of constant inflammation. And that can be from autoimmune conditions, chronic exposure to toxins, chronic ingestion of inflammatory foods. These lead to chronic inflammation. So we understand arthritis. What is arthritis? Exactly, very good. And so we know that arthritis is inflammation of the joints. We just spoke about what is inflammation. Now we want to see, it's setting on fire. Excellent, very good. Now we want to see what causes inflammation. Environmental factors are a common cause of inflammation. Just what surrounds you every day in your house, your car, your office, your environment, that can cause inflammation. Pollution in the air, which is so rampant. That's why us being here this week with all these natural air filtration systems around us, all these trees, that helps to purify the air. That helps us to breathe less toxins. So it's a good idea to spend a lot of time outside in nature amongst trees and in forests. Smoking is a horrible pollutant. If you smoke or if you're exposed to a smoky environment, that is going to begin to break down your immune system and lead to chronic inflammation. Exposure to toxins in the water, mercury, lead, toxins in the soil, all of these chronic exposures lead to the immune system going awry. Persistent infections. Hepatitis. If you have hepatitis, it's a bug that likes to just live in your system forever. Those kinds of chronic inflammation, chronic infection, trigger the immune system continuously. Chronic gum disease. If you are brushing your teeth and your gums are bleeding, that is the beginning point of inflammation because it goes from your gums into your bloodstream and throughout your body. It is vital that we take very good care of our oral hygiene. Eating whole foods, brushing, flossing, and seeing our dentist because that's an entry point for inflammation to happen. A study showed that patients with gingival disease had a higher rate of rheumatoid arthritis. There is a direct connection between gum inflammation and joint arthritis. And also lifestyle factors are causes of chronic inflammation. A poor diet, just being sedentary for too long and getting inadequate amounts of sleep all lead to chronic inflammation. So let's talk about pro-inflammatory foods, foods that cause inflammation. When we eat pro-inflammatory foods, they activate the immune system. They increase the function of white cells, not to help clean up and protect us, but to cause damage to organs and tissues. They increase oxidative stress. That is the junk that hangs around after we've had enzymatic reactions or after we have different cellular processes. We have oxidative stress that's like debris that's floating around. And foods that are inflammatory increase that. Pro-inflammatory foods lead to gut dysbiosis. We've been hearing that term more and more, gut dysbiosis. The bugs inside or GI tract, we have good bugs and bad bugs. Now we have an imbalance. More bad bugs are prevailing because of the foods that we're eating.
Is that what they call flora?
The flora, the people that live there, the bugs that live there, yes, you have good ones, bad ones. And you want to have a nice, healthy balance. But when the bad guys predominate, then you have a dysfunctional flora system. Yes. Now, foods to avoid. So what should I not eat if I have arthritis? Well, number one on my list today is refined sugar. What did I say? Refined sugar. Sugar is not a bad person. Sugar is actually a very delightful lady when she's linked to fiber, the way God created her. God gave us sugar because he loves us, but he put it with fiber for it to be bound together and to go through the GI tract in a normal, natural way. When we remove sugar from her partner, from fiber, we have trouble, serious trouble, and that causes inflammation. When we have refined sugars, like, what are refined sugars? White sugar, powdered sugar, any of those where brown sugar, when you take it away from its fiber. When do you find sugar with her partner fiber? Where do you find that? Fruit, yes, that's God's candy. I tell my kids, you want candy? Have God's candy. That's what he made for you. Sweet potatoes, any kinds of foods that have sugar bound with fiber, that's how God meant for us to eat it. So when you process it, you take her away from that fiber. Now you have sweet potato chips. You have different kinds of sugar that you add to foods. And now she's completely left alone. And when you eat those refined sugars, it spikes your blood sugar levels and causes very high levels of insulin. When you have very high levels of insulin in your body, you end up with triggering of NF-kappa B within the cell. Triggering NF-kappa B releases inflammatory cytokines like interleukin-6 and TNF-alpha. Now, these are serious bad guys. When you see your rheumatologist and they give you a really big fancy drug, a biologic, they're trying to inhibit TNF-alpha. But when our foods are triggering that, we're counteracting what we're trying to do with these big fancy drugs and our foods. TNF-alpha leads to a lot of pain, swelling, and disability. It's an inflammatory player. Also, high blood sugar levels lead to formation of advanced glycation end products. That's when you have all these little sugar molecules bound up to protein, and then that protein becomes extremely reactive and damages cells and tissue. So just by having too much refined sugar and increase in insulin levels, you have damage of joints and tissues. This schematic here is just to show in a very simplified way that high insulin levels eventually leads to triggering of NF-kappa B and inflammatory cytokines. Okay, so we need to avoid refined sugar, essential. We also need to avoid processed meats. Now, processed meats are things like the hot dogs and the deli meats that you get when you're in the deli shop. Yes, the sliced hams and the sliced turkeys and the sliced deli meats. Those are very processed, and their preservatives cause nitrosamine formation, very clearly linked to cancer, colon cancer. It's a WHO category 1 cause of cancer. Yes?
So that can even include vegetarian cold cuts and stuff like that.
So the vegetarian meats do have lots of preservatives in them. They may not lead to the same level of nitrosamines as your animal deli cuts, but the preservatives also are linked to inflammation and disease. Yes. MSG, phosphates, artificial flavors, disrupt the gut microbiome, increase leaky gut syndrome, increase arthritis. So we want to avoid sugars and processed meats when it comes to fighting arthritis. We also want to avoid trans fats. Now, trans fats affect the cell membrane function and affects how our cells can communicate and pass things back and forth. It also activates inflammatory pathways and stimulates what we spoke about before, TNF alpha, interleukin 6, and C-reactive protein. You may have heard of this one because your doctor probably measures that when they're checking for inflammation, but it increases all of these, the trans fats in foods. Now, there was a ban on trans fats years ago, and you may have heard of that. But unfortunately, there's this loophole that prevails that if a product contains less than half a gram of trans fats, they are allowed to say that it's 0 trans fat in the food, even though it's not 0. So we can be eating foods that says 0 trans fat, but they're allowed to say that if it's less than 0.5 grams. And what foods have trans fat? Well, your cookies, pies, pastries, your non-dairy creamers, microwave popcorn, fried, fast food, shortenings, margarines. These are, what was that? These foods all have trans fat. And even though it says no trans fat, which means they have a little trans fat, you don't just eat one cookie or one little piece of pie. You usually eat a lot. And so we're getting an increased level of these bad players in our food. Highly processed foods also are foods that we need to avoid. Packaged snacks, instant noodles, they have additives, preservatives, emulsifiers that disrupt our gut microbiome and affects our immune system. All right, so the first food to avoid was what? Not just sugar, but what kind of sugar? Refined sugar. The next food to avoid was what? The processed meats, right? And what's the next food to avoid? The trans fat. And then the fourth would be your processed and packaged foods. Fifth, alcohol. Now, alcohol is a toxin, just plain and simple. It's poison. It damages your body. For so many years, there was this misconception that just a little bit of red wine will help your immune system, will help your heart. Now we're realizing that even that little bit of red wine has toxic levels, and it damages your brain, your liver, your kidney, your tissues. Now we're being clearly told that as much as possible, remove alcohol from your diet. It is not a health food. Alcohol is not good for our health. There is no safe level. Okay, so we need to avoid refined sugar, processed meats, trans fats, highly processed foods, alcohol, and some of you will not like me after I talk about this, but I have to tell you everything that I know about arthritis. Number 6 is dairy. Okay, so dairy is an inflammatory food. It has many components that make it inflammatory, but just one of them is the casein found in dairy. It's a protein that really can trigger inflammation, especially in sensitive individuals. And for whatever reason, the cows that we have in this United States have a higher level of A1 casein that is much more harmful to the gut lining, whereas in Europe, their cows have A2 casein. Also, goat milk and sheep milk are a little bit on the safer side when it comes to the type of casein, but dairy is an inflammatory food, especially for arthritis. The casein can mimic a certain protein found in our cartilage. So when the immune system attacks this foreign protein that's coming in and makes antibodies to it, those antibodies are going to attack our cartilage and our synovial lining and causes more swelling and inflammation. So that's called molecular mimicry. The protein in the milk looks like what's in our joint, and now we have an attack on our joints because of the confusion. The The commercial dairy products contain so many harmful elements, antibiotics, infection, disease, inflammation, that when we take this in, it helps to disrupt our own gut microbiome and lead to systemic inflammation, worsening autoimmune conditions. So it's best to avoid all forms of dairy. The casein, the fat, the pus, the antibiotics, it does not help our health at all. We're going to talk about a diet that can really help with inflammation, that will give you the calcium that you're looking for in the dairy product, give you the protein, so you don't have to feel that you need dairy to get those types of nutrients. So in summary, the worst diet for arthritis is the standard American diet. That's just the worst diet for arthritis. A Western processed and refined diet, high in processed carbs, sugar, animal protein, fried food, dairy, chemicals, preservatives. That's the diet that's making us feel so icky, so painful, so stiff. That's the diet we need to avoid. All right, so now I've told you to stop eating. Now what can you eat, right? You're saying, what am I going to eat now after hearing this talk? All right, well, we're going to talk about the diet that God has given us so that we can feel great, be mobile, be active, and not have so much pain. The diet for arthritis is really a whole food, plant-predominant diet filled with fruits, vegetables, legumes, whole grains, and omega-3 rich fats. Whole food, plant-based diet is excellent for arthritis. There are lots of articles out now that show that this does work. It works very well. You'll also see articles that say that a Mediterranean-style diet works well, and that also works, but there are some variations which makes me more of a proponent for this type of diet here, whole food, plant-based or plant-predominant diet. All right, so what is high in our whole food plant-based diet? Well, omega-3. We've had a lot of studies looking at omega-3 and rheumatoid arthritis. And we see that omega-3 fats do help to reduce inflammatory prostaglandins and cytokines. And it's shown that patients with the highest amount of omega-3 intake had the lowest levels of C-reactive protein. And it was especially beneficial in rheumatoid arthritis. So how do you get your omega-3? Well, it's naturally found in cold water fish, like salmons, mackerels, tuna. They have high amounts of omega-3, but I am not a proponent so much of eating fish. If you would like to eat fish, have it in small quantities, but I really recommend a plant-based source of omega-3s. Fish tends to have trace amounts of mercury, dioxins, those environmental toxins that we want to avoid so badly. So it's ideal to get it from a plant-based source. And let me ask you, where can you find omega-3 in plants? Any ideas? Flax seeds, yes.
Chia.
Walnuts, chia, yes. You guys are very, very good. Plant sources of omega-3 are chia seeds, flaxseed, walnuts, and hemp seeds. And if you want to take a supplement, of course there's fish oils, but those can go rancid and you have to be careful of the source. So I usually recommend more of an algae-based omega-3 supplement if you want to take that. Omega-3 not only helps with rheumatoid, but it also has been shown to help with osteo. After a few months of taking it, you can notice less stiffness and increased mobility. Fruits and vegetables. Fruits and vegetables are just an amazing source of medicine. They are high in antioxidants. Antioxidants are what go and bind the free radicals, sop up the toxins that are released from your everyday cellular activities, and takes them out and removes them and helps to decrease cancer and pain and inflammation. Antioxidants are high in fruits and vegetables. Also, vitamin C, flavonoids, these are all antioxidants that help with inflammation. The berries are excellent sources of anthocyanins, which decrease inflammation. And the WHO recommends that just to maintain health, the average child needs 5 servings of fruits and vegetables every day. The average woman needs 7 servings of fruits and vegetables every day. And the average man needs 9 servings of fruits and vegetables every day. That's to maintain health, not when you're sick. So if you're sick, what do you think you need? More or less? You need more, much more. That gives you an idea of how much fruits and vegetables we need to be eating. And so, no, you don't have to eat all day. When you eat that amount, guess what? You just need to eat 2 times a day because you spend the whole day working on the fiber. That's how you eat twice a day. No, it's really amazing. The WHO, that's what they say, just to maintain health. And we're talking about disease now. You need a lot more. What else should we be eating on a whole food plant-based diet that's going to help us? Cruciferous vegetables. Cruciferous vegetables are foods like broccoli, cauliflower, kale, Brussels sprouts, and it's a very long list. How many of us are eating these vegetables every day?
Not every day. One day.
Awesome. Very good. Very good. I want to ask you guys, please, you're here to learn about how to fight arthritis with food. I would like to ask you to eat these foods every single day.
Even after what you have to come tired and make it every single day, he said no.
What happened after work? You said after work?
If you have to cook for yourself and then you have to prepare it, how are you going to have time?
We're going to talk about that. We're going to talk about that before we go because I want you to be in the best health possible. So we're going to talk about together how we can do that every single day.
So one question. Cauliflower.
Yes.
Broccoli. You don't have to eat all of them.
No. You don't have to eat every single. You just want to eat from this group of vegetables every single day. Just from that group of vegetables. Even when we're out here camping, every single day. You know why I'm saying that? Because these foods are medicine. When you come to my office to see me and I say, oh my goodness, you have X, Y, and Z. I want you to be better. You want to be better. I can either give you a prescription that has its risks involved and its benefits, or we can do this and really fight. So before we have to have that conversation. I'm telling you now, this is an awesome way to fight arthritis. A very, very awesome way to fight arthritis. It's high in glucosinolates, which break down into sulforaphane and indole 3-carbinol. These are all chemicals that fight for us. They support detoxification, reduce inflammation, and protect against cancer. These are the fighting foods. As we said before, 5 to 9 servings of fruits and vegetables a day is just the start. We need to eat the rainbow, a broad variety of these foods. That's where we get the most benefit from. Now, whole grains, not refined grains. Whole grains have all their clothes on. They have their outer layers. They're completely covered. The refined grains, they've stripped off the covers. They've made them nice and fine and looking all, beautiful. But honestly, those refined grains wreak havoc in our system. It's really, really horrible. Whole grains are things like whole wheat, brown rice, quinoa, oats, the whole oats, amaranth, and there's even more. They reduce inflammation. They have fiber that goes in and really pulls out inflammatory components from our gut. And it's best to soak our grains for hours to help to remove phytic acid, which just by itself can inhibit absorption of certain. So the phytic acids can decrease absorption of iron. So you want to soak your grains, throw out the water, and that will help you to increase iron better. Yes. No, four, F-O-R, for 4 hours. Overnight, beans. Beans are a superfood. They provide protein for muscle maintenance. They have fiber to clear the gut. They have important minerals for bone density and for cellular function. They have isoflavones, or like soy, which have anti-inflammatory action. And beans or lentils really should be had on a frequent basis. They're a great replacement for meat, and it leads to a lot less inflammation. Some individuals find that they have a lot of gas production with beans, so soaking the beans or using Instapot or a pressure cooker can help break down some of those sugars that come from beans that can cause the bloating and the discomfort. Nuts and seeds, very good for a whole food plant-based diet. They're rich in monounsaturated fats, polyunsaturated fats, and they have omega-3s as well. They decrease TNF-alpha, a big inflammatory component we've been talking about, and they have magnesium and other properties that increase immune function. All right, so a question I get all the time is, if I eat a whole food plant-based diet, how will I get my protein? How am I gonna be strong? How will my kids grow? How am I gonna get my protein? Well, yes, protein is very important for kids, for adults, for as we're aging, we need even more protein. But we need to remember that God designed this diet so that we could be completely healthy and functioning very well. And so if you look in the world, the natural world, you'll see that there are many enormous animals that only eat plants. They grow very well, they have lots of muscles, and they're very healthy, like the elephants. They're very big and healthy animals. There are many athletes who are much more active than most of us in here who eat only plants. And so it's not difficult or not impossible to get enough protein on a whole food plant-based diet. So it has enough protein. Almost every plant has some amount of protein in there. The biggest ones are the beans and nuts. Seeds, grains, and even some vegetables have protein. And the athletes, I couldn't remember their names well, but there's a tennis player, Djokovic, plant-based eater. The Williams sisters, plant-based eaters, they are very healthy and strong. And look at this guy. He's not complaining about what he's eating, and he just continues to grow and do very well. So what plant foods are high in protein? Well, temp has about 20 grams of protein per cup. Lentils are pretty good. You only need about between 40 and 60 grams of protein a day. And if a cup of lentils gives you 18 grams, you're one third the way there. Hemp seeds, 10 grams in just 3 tablespoons. Tofu has a lot of protein. The tofu that I get is organic, non-GMO. Soy milk, pea milk, quinoa, black beans, 15 grams of protein. There is adequate protein in these foods. What would it look like? Oh, my QR code went missing. I had a QR code right here. So you could, okay, so we'll get to that. Okay, good. All right, so these are more examples of foods with how much protein they have. And the QR code that's coming up, if you take your phone and just snap that, it will give you this exact list here of the foods and the amount of proteins that they have. 2 cups of leafy greens, 5 grams of protein just by eating spinach. Brown rice, 1 cup, 7 grams of protein. So an example of what enough protein might look like for a day if you were to eat like this. So if you had a cup of oats, and then you put some chia seeds on top, maybe 2 tablespoons, and some almond butter, this is a pretty high protein breakfast right there. If lunch was a half a cup of quinoa, and then you had your greens, you had lentils with it, and then you had greens, And greens are not just a few leaves. You have like 3 cups or 4 cups of greens. That will give you enough protein for that meal. And I want to emphasize large amounts of greens. When I grew up in the Caribbean, and we would have our rice and our beans, and then we'd have like 2 slices of tomato, and that was our vegetables for the day. Or we'd have like a little drop in of cabbage, and that was our vegetables. I really want your salad to look much bigger than anything else that you're eating. You had a question?
Well, that was the same thing I was going to ask when you say cups of greens. I mean, we are not used to putting greens in a cup. So that means if the salad is a compact, we press it down, or just the salad that fits in a cup?
So
I usually eat a whole plate of greens.
you normally have a whole plate of greens?
Yes.
So you can guesstimate, like it's hard to eat salad on a plate. So for avid salad eaters, we tend to eat in a bowl so that it can all stay in there. So this should definitely be full.
Yeah.
More than this should of greens. I completely understand when you say why, because before I learned to eat like this, I was like, what are these people doing? There was a cardiologist who gave a talk once, and she showed me how to make a bowl of salad. And her bowl was bigger than this, full of vegetables. And I was like, how are you going to eat that? But that's what fights disease. It's a good quantity of very healthy food, not little drop-ins of leaves here and there. You need to eat. You need to eat a good amount. That's how we're going to fight disease. So we spoke about breakfast, lunch, snack. If you had 3 to 4 cups of greens, you really don't need to have the snack. You can just scratch this out. Dinner, stir fry, again, more vegetables, right? With the tofu, high in protein, the brown rice, the broccoli, cruciferous, every day we're gonna eat that. This here is not, hard to attain with some practice and forethought preparation. That will help us fight disease. On every level: Alzheimer's, heart disease, colon cancer, this is like one prescription for all those diseases. It's not different medicines for different diseases. It's one thing. This QR code here, if you're able to snap it with your phone, that gives you the outline of what I showed before of the foods that are high in protein. And if you need to come closer, that's fine. And get that there. Yes?
Do you recommend staying away from oils?
Yes.
When it comes to oils, for what I prescribe depends on the type of disease and the type of oil. So if we're talking about, yes, oils are processed, but certain oils I do use. Let's say for arthritis, I'll use flax oil. Some individuals on a Mediterranean diet use olive oil, a good quality olive oil, and that's fine. But if we're fighting heart disease, studies have clearly shown that when you have coronary artery disease and you're trying to clean out plaque, you want to have no oils. So that's one food area where I tailor based on the presentation. Even though the whole food plant-based diet is a prescription for all of those diseases, there are some nuances with what you might have. Okay, so what about iron? I get this all the time. My iron is low. I need to eat meat. When I was pregnant with my first, second, third, one of my children, I went to my OB and my iron was low and I was anemic. And I love my OB. She's so thorough. She's awesome. But she looked at me and she said, it's time to start eating steak. I was like, what? Steak just for iron? No. And trust me, she's very well educated. She is brilliant, but she just did not understand that is not God's prescription. You don't need to eat steak to get iron. You can eat enough plant foods to get your iron, but the key is you must pair it with vitamin C. Too many times I've treated individuals who have low iron and they're eating more iron-rich foods. They're having their molasses, their spinach, their lentils, but they're not pairing it with the vitamin C they need. So iron absorbs with vitamin C, so you have to make sure you get enough of that to properly absorb. Plant iron and iron from meat, they're different. So plants is a non-heme iron. Meat-based, it's heme iron. Heme iron absorbs more rapidly, it absorbs quicker, yes. Non-heme iron has lower absorption rate, but when you have your vitamin C, you'll absorb it faster and you absorb what you need. If you eat too much heme iron, you can get iron overload. Iron overload can cause inflammation and pain and cancer. Because God's ideal was for us to eat plants, absorb what we need, and the rest we don't have to accumulate. So plant sources of iron are effective, but you need to eat a lot of plant iron. You get it in lentils, spinach, tofu, quinoa, pumpkin seeds. The list is so long, molasses, nuts, but you have to eat a lot of it, and you have to take it with vitamin C. Yes?
Should men have less iron? I've heard that men should not have as much iron as women.
Well, it would depend on their conditions. So men tend to be bigger intakers of meat. Men they just love meat. And so they tend to have more iron levels. I don't usually have the same issues with low iron as women. Women menstruate, they lose blood. So there's this constant issue with iron for women. Men don't always have that issue as much. Yes?
Vitamin C, how about even like squeezing lemon on salads and stuff? Is that enough, or do you need to put in some fruit or something with your salad?
Sure. So I always like to be able to follow something just by nature of what I do. So I like to know where we're starting, what's your iron level, what's your hemoglobin, what's your blood count like. So we know the severity, how serious is it for you. If it's a mild case, the vitamin C from the foods, let's say the lemon, the sweet peppers, the Brussels sprouts, those would be enough vitamin C. If it's a significant case, I may even have them add a vitamin C supplement, like a liposomal vitamin C, to help with absorption. So it's good to know what level we're at and then to follow it. Check it a few months later and see if you've gotten to the goal. Yes.
I found that for me, turmeric,
Yes.
it works wonders for inflammation.
Yes.
I take a capsule, 1 capsule a day.
Yes.
And it works fantastic for me.
That's
I do
awesome.
2,000 milligrams.
Awesome. Turmeric is an excellent
And I
anti-inflammatory
also
agent.
avoid most of the nightshade vegetables.
Yes. Yes. And some individuals do have a sensitivity to nightshades. Your eggplants, your unripened potatoes, your peppers, tomatoes. That can make some arthritis conditions worse. But not every patient has that. But I'm glad that you observe your body well so you know what you're responding to. And that's where we need to be. We need to know what's affecting us. All right. Okay, so the plant-based iron we spoke about. One trick cook in a cast iron pans, and you can absorb small amounts of iron in your food. Definitely pairing with vitamin C, like we said before, citrus, peppers, tomatoes, and avoiding things that will block absorption of iron, like coffee and tea, which we don't advocate. And this is the QR code for what I just said before, if you want that. Pastor, what time is it now, please?
It's almost 11:30. I think you have till 12.
Okay, all right, okay. Because we were going to talk a little bit about certain foods, but we'll see. We'll go with the flow of the room and what you guys would like to cover. Okay, so before I go any further, because I can talk for a very, very long time about food and different things, so I want to hear what some of your concerns are. I want to address your concern about how do we do this, and I would like corporate input from all of us to see how we can help each other succeed.
Are you
Yes.
going to feed us smoothies?
No, I wasn't going to feed you
Well, you
smoothies.
have that
Okay, I'll tell you. Yes?
I have a question. I have IBS.
Yes.
So some of these foods
Yes.
really attack the bowel. Like if I have lentils, I have a problem. What would you suggest? Also beans.
Sure, definitely. So when it comes to certain foods that are very high in fiber, so inflammatory bowel syndrome is difficult for your your tummy to adjust to certain high fiber foods, gas forming foods, and many times your stomach is just uneasy and not feeling well. So you need a good reset and a good cleaning of your bowels. Your gut bugs have to almost be repopulated and readjusted. So the foods that make you not feel well now, I would either cook them very, very, very well, like down to like a mush, so it can be more easily digested, and also help with your retraining your gut by trying something called intermittent fasting, like just eating at certain times, so that your gut can heal during the times that you're not eating. So I would still recommend a whole food, plant-based diet, cooking your grains down really, really well, cooking the beans down really, really well, and not eating, just eating 2 separate times. Yeah. And yes, Sister Dawson.
Also, I heard that sprouting.
Yes, sprouting.
Also helps them to absorb a lot better.
That's true. Thank you for that. When you sprout grains and beans, it helps the foods be more easily digested because you're almost pre-digesting them before you take them in your mouth. So your gut can do better. It certainly can, but it would require very slow, patient re-inoculation of your gut with good bugs and eating those foods sprouted or cooked down very well.
Yeah, and I noticed the greatest poison for me is dairy.
Yes, that is not helping your IBS at all. And you can tell in your own body. Yeah?
Right.
Yes.
Yes, I also know that, we can be doing everything right,
Yes.
but if we're emotionally disturbed, our emotions do affect.
Mm-hmm.
Like I was at the Mary Heart Lewis was good as medicine.
Yes.
So
That's true.
I have found that you can do all the right food, all the right movements,
Yeah.
but still have issues because you're under a lot of stress and you're not dealing with one of the 8 laws of trusting divine power.
That's true. That's very true. I agree. So it's a whole package. Definitely a whole package. I agree.
So when a person has arthritis, is that something like eternal?
No, it's not. So when you come to me, my conventional hat will say to you, you know what, you have rheumatoid, this is a forever disease, you have to just live with it. That's what all my colleagues will say. But when I put on my holistic Seventh-day Adventist hat, I can say to you, you know what, there is a way to eradicate this. Let's try God's way. And we would look at, like what Sister Dawson said, the whole picture, the different laws of health, the diet, emotion, stressing, moving, and see how God works to help with the inflammation. So it's not a forever thing. No. Yes.
Reading the labels is very important because even we've noticed that some vegetarian like cheeses.
Yeah. Casein, yes. It's so frustrating. Yeah.
And also another thing that causes inflammation is like for athletes, bumping and
Oh, the trauma of the exercising. Yeah, overdoing it. Yes, definitely. I agree.
bone on my right knee right now.
Yes, so you had injury that triggered your arthritis. That can happen, definitely. Okay. I want us to talk a little bit about how can we live this way, because that's the biggest issue. Yes, the science shows, the research shows that if I eat a whole food plant-based diet, I can fight disease. I need to eat large quantities of vegetables every day. How am I going to do this? So I'll give you my thoughts, and I'd love the thoughts of others in here. What have you found to be successful? So I found that, first of all, realizing that whole foods, what they are, first of all. Whole foods are foods that don't need a label. They're just one ingredient foods. That's the first thing. So I need to know what is a whole food. What do I need to eat? I need to make sure I understand that very well. So when it comes to fruits, it's the fruit, the apple is whole. Not the apple chip, not the apple pie, the apple is whole. When it comes to beans, it's the bean. It's not like, it's a whole food, okay? So I need to know what to eat. Next, I need to realize that I need to really think ahead. I need to think about my next meal before, from today, what am I going to eat tomorrow? I can't wait till today to like, okay, what am I going to eat? I need to prepare. This is a lifestyle that needs to have forethought and preparation. So I need to actually think about how I'm going to eat, and I need to plan for that. So I'm planning this week, I'm going to have whole fruits with, let's say, whole grains for breakfast. So maybe I'll have oat groats. Maybe I'll put that in the crock pot, or maybe I'll make a whole lot of it in a pot and put it in the refrigerator. So I need to start planning ahead with food in the fridge of what am I going to eat Monday, Tuesday. I need to prepare the food ahead of time. Okay, my salad, a lot of chopping. I could chop up a lot of broccoli or stuff for a few days. When I'm making my salads, because I go to work every day now, I like to have salads in the fridge for Monday, Tuesday, Wednesday. I just pull it out and I run to work. I got to pull and go. I can't be chopping up every morning. I have to be gone. So I have to prepare it ahead of time. I have 4 kids at home and I work. If I don't plan ahead, we'll all just eat whatever we can find, just grab. But if it's prepared ahead of time, everybody knows, just go in there, take it, go, and you can eat. It has to be prepared ahead of time.
Okay. Like you said, to eat the green, this ball can be 4 cups of green. You see me coming up potluck on Saturday, get this one? They will yell at me.
If you have it at potluck?
Yeah, to take the salad only to eat. Like you said, you have to eat at least 4 cups.
Yeah, so for potluck, so when everybody has their plate, I have my bowl, right? So I fill it up with the vegetables first, and then yes, I'll try you made those beans. I'll try your beans. I'll put a little bit on. The salad is your base. The salad is your.
I know, but you cannot come to the table and fill your bowl and then move. People will yell at you. It's not only you. You have to share.
Oh no! Bring enough for everybody.
It's not only me. It's everyone has to share the food that bring to the table.
So you're saying you can't bring enough salad for everybody to eat at potluck?
No, I don't have money for that.
You know what? I've noticed at my church, Pastor, I go to Connecticut Valley mostly now because that's where I've been most active. And I found a whole shift in how our potluck looks. Potluck before you would go and you would hardly be able to find fresh salads. Now, when you go to potluck, you have like the whole table has different types of salads because our mindset is changing at church. And now we're realizing that we all need to be eating this way and we need to help each other eat this way. So potluck is going to take time, but as we learn, we change and we help each other.
I have a question. Because last time we always have people coming to our church doing those sessions for us. Last time we have one at the church, the woman said we have to eat a big breakfast in the morning, and with 5 hours we eat. At least we have to eat twice a day. If you eat at 9 o'clock in the morning, you have to eat at 3 o'clock or 4 o'clock, and then you have to eat the next day. But for you, you have the 3 meals plus snack. At least you say you can go out with the snack, but you have to eat the 3 meals. But she said, no, 3 meals is too much for our body.
Yeah.
It's like a little bit confusing. Every time you hear someone, they're coming with a different method. You don't know what to choose. You don't know how to adapt yourself to
Sure.
things they keep telling you.
Yes, no, I understand. So so we have good, better, best. So it's first of all, we want to start with whole. We want to get that in our mind. We're trying to eat whole foods. That's where we want to start. We can't.
Whole food too is the whole food, not snack.
Yes.
The way you have to eat those
Yes.
foods.
So if you eat 3 meals a day now, we want to at least stay with that and try to make everything whole. And as we progress to become better in our health journey, then we drop the snack in. And as we get better, ideally we want to eat 2 meals a day. That's where we're aiming for. That's the best for health. If it's hard at first, you just keep trying. But ideally, 2 is best. But if you're at 3 now, that's fine. You just work your way up. This is progress. This is not overnight perfection. It takes time. It takes time to get better. Like sanctification, it takes time. Yes.
When I was 40, my kids, I have to set my alarm clock. I have arthritis, rheumatoid. It runs in my family. So I have to set my alarm clock at 4 o'clock in the morning to wake up because it took me 1 hour to get out of the bed.
Yeah.
Sometimes I couldn't move because my whole body got paralyzed. And I have to roll down and fall in the floor. And the shock will help me move. So that is to have my kids at 6:30 having breakfast on the table, because we have breakfast, and then I have to shuffle them to different schools.
Yes.
So doctors couldn't help me. And then I started reading on 2019. I said, well, this is not a bad thing during the COVID. I said, I'm going to read all these books. So I got the collection of Ellen G. White.
Yes.
And I started putting it into practice.
Yes.
And I found, then I got more interested and I started doing research. This is all on my own. About inflammation and all of this, what's arthritis, what causes it. And what helped me the most was I got into the raw diet.
Raw, okay.
Oh, yeah.
And blending. So it's hard to cook for me, to cook for the kids.
Yes.
So I ended up eating most of my stuff raw.
Yes.
And sometimes I couldn't. By the time I finished chewing the salad, my jaw was so tired that I couldn't eat anything else. So I'm chewing carrots. That was terrible. That's really, I understand why the rabbits eat carrots now. So, but the thing is that I started putting everything in the blender.
Yes.
And I will just, sometimes I will strain it and drink it with a straw.
Yeah.
Or just drink it straight up there.
Mm-hmm.
So then I started feeling the changes.
Yes.
I started moving my things. And my girlfriend had the fingers all twisted like that. And she was on
Different medications, right?
yeah, different type of medication and hormones and things like that. So, but that's what helped mostly raw food, the drinks, and the food.
Yes, yes. That's wonderful. Thank you for sharing that testimony. So your rheumatoid is in remission?
No, I wanted to tell you that. So, I found out I can't drink soda.
Yeah.
I was never fun at that, but for some reason, when you are getting healed, like the table brings that to you.
Oh, yes.
Free. So I went to the store there, they are on sale, and I bought 6 of them. And I said, well, these are Seventh-day Adventist soda. And then all of a sudden, I have these 2 fingers, and these 2 fingers at the same time tingling.
Yes.
And then hurting, and all of that. And I said, I bought 6, I'm going to drink the other one, so they got worse.
Yeah.
Then I have the other one.
Yes. Yes. So your rheumatoid arthritis is controlled on a whole food diet. When you deviate and have processed foods, you trigger inflammation and you feel it again. That's exactly how it works. That I agree with you because that's my experience exactly. Yes? Yes.
I need a little expanding on that because I don't quite understand.
Yeah, sure. So the fruit and vegetable mixing, I have not come across any clear data or research that says that it leads to any ill effect. But in just trying to understand the way that the foods digest, I look at it from a digestion point of view. So certain foods digest at different rates. And if you're going to mix them and some will digest faster or slower and kind of hang around in the gut, it could lead to what they call putrefaction and, alcohol buildup and inflammation. But that's been counseled, but I don't know if it certainly necessarily pertains to every single person. I mean, I think those who are more sensitive should avoid that. Let's say for folks who have IBS or different inflammatory conditions, they should at least try that. But I don't have any solid science to say that.
If it affects you.
Yes, okay.
Some people have it way worse than the other.
Yes, because some of us do have very weak digestive functioning, and so we should probably separate that. But I think it's the rate of digestion in the stomach. Yes.
I was just going to say there seems to be the debate with some people about the fruits and vegetables, about especially with the even down to the lemon juice, squeezing it on the greens she talked about. But when I studied it later, this is many years ago, that it actually was beneficial. It helps to draw the calcium out and the nutrients of of the food. And so there's, like you said, there has to be a balance of understanding, because if you say no fruits, no vegetables, and it's like to them, well, that's a fruit, realizing that that's really a digestive aid. It actually has a lot more benefits in that. So
Yes.
it's a sensitive issue because some people take it to extremes.
Yes.
You know, and so we just got to be careful, like you said, balance. You know, everything doesn't work the same for everybody.
Yes.
Because she said those that have weak stomachs.
Yes.
Weak something, she said.
Yes.
Yeah.
So I think that would be a more case by case.
Right.
And if you eat a combination and you do feel discomfort or unease, then you should try to separate. We really have to be in tune with how we're feeling and how we're doing.
Question. Microwaving.
Yes, it's not the best idea. And I do not own a microwave in my house. So the foods are, Hiroshima, when they just threw, it's like throwing nuclear attack on your food and damaging the molecular components. And so I don't want to put my food in the microwave. I mean, if I come to your house and you have a microwave, of course, I will eat what you give me, but I don't zap my food every day.
I don't ever.
Yes, no, I don't think it's a good health practice, so I avoid it.
I can cut the pineapple for you.
You want to cut the pineapple? Okay, so so I have this pineapple here because I wanted to just highlight some foods that are good for arthritis. Now, pineapples this is God's candy. This is true candy right here. And this is where the sugar and the fiber are bound together beautifully. And when I was younger, I was so afraid to cut a pineapple. I thought it was something that required all of this expertise, but it really doesn't. To know if the pineapple is ready, I try to see if I can pull out the center leaf, and it comes out well. So this one is very red, and you can see it's very, very green. Pineapples are high in bromelain, which is a enzyme that helps with digestion and with inflammation. And the bromelain is found mostly in the stem here, the stalk part, and in the core, the center of the pineapple. So my kids, when they eat pineapples, they eat around the core and they throw away the core. No, please eat the core part. Okay. I don't know how to cut it. How do you cut a pineapple? I go down, 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 down like that. How do you cut it?
Yes, but you're cutting too thin.
I'm cutting the pineapple too thin?
Afraid, yes.
Oh, I'm afraid?
Yes.
Yeah. When I cut my pineapple, I do not throw away the skin, right? I save the skin, and what do you think I do with the skin? I make a tea. So, of course, I'll start by washing the skin very well and making sure that I pick a pineapple that is not like sprayed like crazy, especially the ones that are coming from Hawaii that are so GMO and sprayed. And then, so I wash it and I put the skin in the pot right away so that I can have, and I'm using the stem too, because that's where most of the bromelain is. I put it all in the pot. And this is a part of prepping for the week, because you don't have to buy juice for anybody in the home during the week, because you're making a big pot of pineapple ginger tea for everybody to drink. So you have tons of glasses like this in the fridge lined up for everybody to drink their juice. If somebody can't take sugar like me because my joints will hurt, guess what? I'll drink my tea without sugar. If somebody wants sugar, like my kids or my husband, they'll just add their whatever they want, their local honey, they'll add their agave. But this is the juice that we've made. We didn't have to get it from the store with colors, dyes, and preservatives, which really affect our gut microbiome and make us sick. So I put all of this in the pot and make sure that these foods are available in the house for the kids to eat all the time. Instead of having too many packaged and prepared things for them to grab, this is fast food right here. If it's in the house, it's fast, right? If it's already cut, it's fast. All right, so All right, so I put all of that in there. And then I have my ginger. You should always have ginger in your home. Always have ginger. It helps with GI discomfort. It helps fight inflammation. It helps pain. It helps with migraines. Now, I usually have my pesto, but I don't have it here. So you have to improvise, right? So, of course, I would wash this. Sometimes I peel the skin off just lightly, or I just scrub it with my dishwashing thing, and I pound it up. Okay.
You better off with the knife.
Oh, you know what? I find that mashing it, I get more surface area than just slicing it up. Or I could have put it in here. I could put it in here. Yeah, I could put it in here.
But in smaller pieces.
Let's see what's gonna happen.
Yes.
Is it plugged in? All right. All right, so it's not doing all of it. And I put it in here.
Oh, for the tea?
Yeah, the tea. For the pineapple, I'm not making.
Are we making a smoothie with the other?
I'm not feeding you this one today because I didn't come prepared to feed you. I'm just using my hands. This is just for demonstration only. I'm sorry. I didn't wear my gloves, get ready, well prepared. But this here, I would fill it up with water. So I have my ginger, I have my pineapple peel. I'll fill it up with water.
Can you put the stick of cinnamon too?
You want a stick of cinnamon?
And the tea.
That's fine. That's fine. Yeah.
To make that taste.
Yeah. What else you want to add to it?
Basil.
What else you guys want to add to it? Cloves? Yeah, you could put cloves. Maybe some lemon.
Allspice.
Maybe some lemon. Maybe some turmeric.
Yeah, no.
You can buy your turmeric and you can mash it up and put it in here. So you're making juice for the pot. Use a bigger pot.
Yes.
Use a much bigger pot. Fill it up. Put it on to boil. Let it cool. And then fill tons of glassware. Put it in the fridge and drink that all week long. You're fighting inflammation. You're fighting pain. And you are avoiding buying processed things, processed foods, right? Now the pineapple, I just want to take off the skin here. And what I'm going to make with the pineapple is just a spread that you can put on your oatmeal, put on your brown rice. What else could you put it on? You could put it on your Ezekiel bread.
Then after cook, you put it on top?
I'm not going to cook the pineapple today because cooking can decrease the amount of bromelain that I have. So I'm doing an arthritis recipe. I'm thinking of just arthritis today, but it fights other things, right? Not just arthritis. God's recipe fights almost everything. And I'm going to add prunes. Now, why would we add prunes? What do prunes do for you? They're high in fiber. They clean out your colon. They help with your gut microbiome rebalancing. It helps with, is high in vitamin K. It helps with your bone strength, right? Because with your bone strength, you need vitamin D, calcium, and vitamin K to have strong bones. So it does help with your bone strength. All right. You could, but I'm using prunes today. All right, so I'm just using this is probably, I'd say, a quarter cup of dates. And I'm using flaxseed. Which kind should I use, the ground or the whole? So yeah, whole is your go-to phrase, right? Whole, I know. But if you use the whole flaxseed and you put it in the Vitamix doesn't get the whole flaxseed broken down as much as I'd like. So I'd have to use a coffee grinder to get it to look like this. So I do buy mine whole and I put it in the coffee grinder and use it. But for today, I said we could go easy and get the ground up one. when it's ground up like this, it has a shorter shelf life. It goes rancid faster. This will last longer, the whole one. So I'm going to use about 2 tablespoons of the ground flaxseed. And if you have any issues with arthritis, constipation, take 2 tablespoons of this a day. Ground flaxseed, 2 tablespoons.
Just on me. Just on me.
The flaxseed meal.
No, if you can put it on your juice or in your meal.
Oh, where should you put it? You can put it in your juice, your milk, your salad, your oatmeal, your rice. You just sprinkle. Make it a habit to sprinkle it. Right? And what we're having here, what I'm making here is not a smoothie. It's more like a chutney that we didn't cook, that you're going to keep in the fridge. I need some kind of liquid. Let's see what happens. I think I need a little bit of liquid. I put prunes in here. Somebody wanted to put dates, but I said I had prunes today. I have prunes today. Oh, prunes to date. Oh, let me take a look. You can leave it there. Thank you. Ooh. All right. So this is not for us to taste today. But if you look at the consistency, you can see that this is something you could this is sweet. You could easily add this to what? What can you add this to? To your oatmeal. It will make it more nutrient dense. You see? Your pancakes. Yeah. What can you add? Look at it. It's like, this is just a natural, sweet, like, not jelly, but like a paste. You could put on your bread. It's a nice sauce.
How long does it last?
So you can put it in a nice glass jar and put it in your fridge. It could last a good 3 weeks, 2 to 3 weeks. Somebody said you could freeze it. You could put it in ice cubes and freeze it.
Oh, yeah.
Yeah, but this is a food that is high in fiber. It's high in omega-3, right? Yep. It has the bromelain, helps with pain, helps with digestion, and it's not processed. You see, it's not processed.
You can freeze it?
Yes, you can freeze it. Okay? So I just wanted to show you and this was simple. It's a 3-ingredient paste that's not processed. It has very friendly sugar that's bound to fiber, and it helps with pain and arthritis. So I'd love for all of us to just ask for God's staying power, to use his prescription for healing, because it works, but it just requires submission and trust in God. When we submit to him and we trust him, he will do the healing. It's not the food, it's just obeying him. It's just obeying him, following what he says, and we will be healed. So I just pray for us all. Please pray for me, and may God keep us well.